Everyone. This is Michelle Gramoglia, President and CEO here at Woodland Pond, and this is my weekly address for a Tuesday. Today is Tuesday, March 19th, 2024. We're going to start with some exciting calendar events. Today at 2 p.m. in the PAC, the Land Conservation Committee is going to be presenting SUNY New Paltz Professor Emeritus Ron Knapp, who is a cultural and historical geographer. And he is going to be giving a presentation that I think is going to be super interesting. And that is related to crossing the Walk-Hill, New Paltz covered bridges then and now. I would definitely encourage you to catch that today too in the PAC. Tomorrow at 1:30 in the PAC, and this is really important that I emphasize that this particular meeting and all of our public meetings, opportunities, lecture series, presenters, etc., are here for every resident at Woodland Pond that can safely get to the PAC or get to the classroom or get to the great room if that's where the event is. Just because something is located physically in one part of the community or another, it's really important that you all know that you're all invited. So tomorrow at 1:30 p.m. in the PAC is the management question and answer session that we have every month on the third Wednesday. And in addition to all of the normal updates that we will get from each of our department heads, tomorrow we're going to be introducing to you our new capital projects manager, David Roberts. And you will also have an opportunity to not only meet David and understand what his role is going to be in the expansion and renovation work, but also to get an update on where we are with the expansion and renovation. So really important for you to attend those meetings, or at the very least, catch them on replay. On Thursday at 2 p.m. in the PAC, we are going to have our most recent installment of Council Connections, which is where someone from the Residents Council interviews a person of their choosing. And this week they are interviewing John Ortner in his role as the chair of the Design and Decor Committee. So if you're interested in understanding how things get hung on the walls, how certain decorating or decor recommendations are discussed with management, the management liaison, Shannon Scaturo, it would be great for you to watch Council Connections on Thursday at 2. On Friday, we have our blood drive with the American Red Cross. We do this roughly once a quarter. You've heard me say how important I think this is. We may have a time slot or two still available. You can sign up with the American Red Cross, and this is, of course, open to the public, open to staff, open to residents. We want to fill up that room on Friday, but because the blood drive will be in the PAC all day on Friday, yoga will be moved to the classroom at 10 a.m. and Simple Melodies will be also moved to the classroom at 3 p.m. On Saturday at 7 p.m. in the PAC, we will be having a program brought to you by the Interfaith Committee in observance of Purim. And there will be a reading of the Megillah. I'm probably pronouncing that incorrectly, but that will be at 7 p.m. on Saturday in the PAC. And the next calendar item is that on Sunday, March 24th at 3 p.m. in the PAC, we will welcome Benjamin Wheel and James Stewart, who come to us quite frequently, and they are going to be presenting a combined vocal and piano program of Schumann song classics. 2 things for your calendar for April 22nd. I know that this is looking forward, but better to plan. Our Land Conservation Committee, again, will be taking the lead on the Adopt a Highway for the quarter. For those that are not aware, Woodland Pond is a sponsor of the Adopt a Highway program on a high traffic area of Route 299, sort of in the vicinity of Lowe's home store on 299. And once a quarter, we get a group of residents and hopefully staff member volunteers to go out with protective gear on and do a traditional Adopt a Highway event. And the next one is going to be at on April 22nd, departing Woodland Pond at 11:15. We will do a combination of Woodland Pond transportation vehicles and carpool. And that evening, April 22nd, will be a program brought to you by the Shalom Space group. And that is going to be a first night Seder, and you will sign up with that, I believe, with concierge. They can give you more information, but it's a full dinner. It is BYOB, but the full dinner, the full celebration, etc., and that is a cost of $45 that Shalom Space worked out with the dining room. Now moving on to some non-calendar related items, just a couple of knit-knat type things. Periodically, several times a week actually, we do find that one or more of our cottage residents leaves their garage door open at night. And this is the announcement to let you know that in the future, starting effectively immediately, we are going to close your garage door for you if we find it open with the passcode that we have on file for you. So just be aware, it had been the case that it gets reported on our security report. We will now be closing those for you. I don't want you to be surprised by that. The next is related to the safety reminder that I am going to be talking about until we start to see some traction here. But we are going to be asking folks from a safety perspective to please only use the sidewalks when you're walking, jogging, doing outdoor activities, walking your dogs, etc., especially in the front perimeter road, sort of in front of concierge. There's no shoulder there. There's no path there. It's not marked for pedestrian walking, and cars fly through there regardless of what we do. I watch it every day from my window. There's a huge safety risk, and we really need people not to be walking on our roadways unless you are on a sidewalk. That includes jogging. You certainly should not be doing other activities on this campus unless you can do them safely, and that means on wheels. So bikes, rollerblading, etc. That stuff really is kind of tricky on this campus because the roads are not really made with shoulders or paths for that. And I'm very concerned that something is going to happen. So please consider those activities as something that you should be doing, on wider roads where they're marked with shoulders and where they're designed for that. But at a minimum, we are asking people not to walk your dogs, not to take walks. This is going to apply to staff as well. We will actually be moving the dog waste station from where it is across from concierge to a location on the side of the building closer to the community gardens. So look for that to happen in the next week. So you know that that's not an incentive to bring your dogs across the street. It's just really a ticking time bomb without the roads being properly marked or designed for that use. The next thing is related to insurance. And this is really important. And I hope that everybody listens to this. I'm going to highlight it and emphasize it with the sending out of the constant contact message. For those residents that have a Medicare Advantage plan, so you do not have traditional Medicare, you have a Medicare Advantage plan, most likely because something happened with your retirement and they changed what they would pay for from being a Medicare Advantage, traditional Medicare to a Medicare Advantage plan. I must emphasize and warn you that these plans are very risky. There is a risk and there's a benefit. The risk to you initially and immediately is that they cost more for you, because if your retirement plan will only pay for a Medicare Advantage plan, to switch out of that means you're going to have to pay for Medicare out of pocket. But I'm here to tell you just some of the real facts. I did an analysis of how many of our residents have switched to Medicare Advantage plans and what their experience has been like when they need that coverage most, which is when you are rehabilitating in skilled nursing from an illness, from a broken bone, from a surgery, etc. In the last 6 months, we have had 7 residents that have had stays in skilled nursing that have had Medicare Advantage plans. This is probably roughly 40% of our residents that have needed a skilled nursing stay are now using Medicare Advantage plans, whereas, 5 years ago, it was nearly unheard of. Of those 7, the HMO, which is exactly what the Medicare Advantage plan is, has told us that their utilization teams have determined that those residents need to be cut from coverage just when they need it most too soon. 7 out of the 8 appealed the decision. I'm sorry, 6 out of the 7 appealed that decision. Their families appealed it. They said, I'm not ready yet. My bones haven't healed. I haven't even been cleared by the orthopedist yet. Or maybe I have a surgical wound. I'm still getting nursing care. I still very much qualify and need skilled nursing. I need rehabilitation. So they've issued the formal appeals to the Medicare Advantage companies, the HMOs that control your fate in the skilled nursing environment. Has nothing to do with Woodland Pond, and they have been denied. All but one have been denied. So we and the family and the resident feel this person still needs to rehabilitate for obvious reasons. Their orthopedist hasn't cleared them yet to be able to walk. They have surgical wounds. Maybe they have, a Foley catheter. The HMOs in all but one case just in the last 6 months have denied those appeals, despite the fact that they have a medical necessity for coverage. This is not within our control. The other thing that you need to understand with these plans, I know they seem great when you have to go to the doctor's office and cover dentures, and it's great because the retirement plans are covering the cost. But you also have to understand that even coming to skilled nursing when you need it is not a sure thing with these plans. They make the decision, not us and not you. We had a circumstance over the weekend where a resident had gone out to the hospital. He had been in the hospital, went to skilled nursing temporarily, and then went back to the hospital. Even though he had been in skilled just prior to that hospitalization, the hospital could not release him because we cannot take a resident that has a Medicare Advantage plan into skilled nursing without an authorization from the HMO. So it's not just the simple process where it's the hospital and Woodland Pond and the resident and their family making the decision. The HMO gets inserted into that decision. And you can bet your bottom dollar that they are not financially motivated to find a reason that you need skilled nursing rehab. Now you have your life care coverage, you have your continuing care coverage, and that's going to cover, food, bed, room and board, assistance with basic things. But what you really need is the rehab coverage. And the rehab coverage comes from Medicare Part A or a Medicare Advantage plan. And as soon as you've got that Medicare Advantage plan, the HMO is pulling the strings on all of it. They're pulling the strings on whether or not you're authorized to come to us. They're pulling the strings on whether or not you stay in services. It is a huge risk. I really want everyone that has these Medicare Advantage plans to really sit down and say to yourself, is this worth the $250 a month that I would have to pay to pick up, Medicare secondary? It's a hard decision because it's not a free decision, but your fate is in someone else's hands, and Woodland Pond has no control over it. And you have no control over it. And the appeals are getting denied right and left. And there's plenty of literature out that you can research yourself that will tell you the pitfalls of Medicare Advantage plans. They seem great when you're well, but once you're sick, they're controlling the process and they're controlling your medical care. That does not happen with traditional Medicare with an AARP or other type of supplement. I just really need folks to be aware of this and really be thinking about it. These are conversations that you can have with Christy, our Director of Finance. She's seen it all. She can tell you the exposures, but you really need to be thinking, is this worth my health and my wellness? But I needed to share that with you. The last thing I wanted to talk about is related to the very successful rollout and use of our Happy or Not opportunities, not just at the kiosks there by the hostess station, but either on your cell phone using the QR codes on the tables, or typing in things on your computer. So since we've rolled this out last week, I just wanted to mention a few things. We're seeing an uptick in the number of folks that are leaving comments, which is perfect. A few tips that will help your experience be a little bit better. There are often times that you're leaving us comments on things, but not your name. Now, again, only we see this. So this doesn't go out to the residents. It's just me, I see it, Amy sees it, and Amy's boss sees it from Sodexo. And then Ashley, our administrative and scheduling Jill of all trades, sees this as well. But your name doesn't go out publicly to anyone. But for example, we had someone leave a comment last week that says, my mother needs to have food with no tomatoes, no onions, no lemons, and no citric acid. Okay, great. We need to know who that resident is so that we can make sure that their dietary restrictions are identified in our system. And we need to be able to get back to the daughter that left the message. So if you don't leave us the resident name or your name there, we cannot get back to you. So anytime you do this, some residents are really good about it. If you have a question or a constructive criticism, please do leave your name so that we can get back to you. The next thing is, please be careful. We did send a link out with Constant Contact last week, and we included 2 links, one for independent living dining room and one for assisted living dining room. Those reports populate into different, or those comments and feedback go into different reports in Happy or Not. And it's extremely important for us to know which dining room we're talking about. So please make sure that when you're, if you bookmark the link on your computer or whatever, and you reside in independent living, that it's the independent living link. And if you reside in assisted living or your family member does, that you're using the assisted living link, because obviously there's different service provision and things like that. We need to know where it's going. And the last thing I just want to reiterate, and I can't beg you a million times for this. I've got a couple of comments last week that, and over the weekend, someone thought that their omelet was too small. Someone thought that their chicken francaise was too tough. We have invested an enormous amount in bringing managers to every meal. Assisted living is the same thing. We've got servers right there for you. We want you to send it back. If you're not satisfied with your meal for any reason, we're asking, begging, imploring for you to send it back in that moment. We want the opportunity to fix your experience. We don't want you to feel like your food wasn't warm enough. We don't want you to think your omelet was too small. We want you to be satisfied. We want you to be happy. And the machine is great because it can tell us what your experience was. But the better thing would be for you, instead of putting a red circle because you're unhappy and your chicken was too tough and your omelet was too small, that you're actually able to give us a green smiley face in that place because you empowered yourself to turn the meal back in or get help. And then we were able to be responsive right away. So turning what would have been a red circumstance into a green circumstance, meaning happy. Not everything's going to be perfect the first time it comes out. We may make a mistake. There might have been a piece of food that, didn't come out exactly as we wanted it to from a preparation perspective. But our goal is to fix it in real time and turn your frown upside down, so to speak, but turn what might have been a red response, meaning unhappy, to a green response because you're so happy that you took the time to ask us for a new meal and we did it and you were satisfied with that one. And that should be a green, good outcome for everyone. So just a few things there with Happy or Not. Please keep a lookout for things coming to you on email from Constant Contact, and we will be doing an email survey of email use coming up in the next couple of weeks from SurveyMonkey. So just keep an eye on your emails. Thanks, everyone. Have a great day.